All right, well, let's go ahead and get started. And thank you again to folks for joining us today for our Doctors in webinar on the health effects of loneliness. My name is David Griffith. I'm the Director of Programs and Outreach for the Elder Initiative at the William Wade Community Center. For any of you who are new to Doctors In, this is a partnership that we have between the Elder Initiative at William Wade and the Jefferson Department of Family and Community Medicine and the Jefferson Center for Urban Health, where we have Jefferson doctors join us each month to cover a different health topic. We've been doing this series for going on 4 years now. And today's topic on loneliness, this is actually one that we did as a Doctors In program just a couple months before the pandemic. I think it was like November of 2019, not knowing how much loneliness was really gonna have an even greater presence for everyone in some way over the course of the past 2 years with this pandemic. And so we thought it was important to revisit this topic, so much more of a focus being put onto the impact of loneliness on mental health and emotional health and physical health, that we wanted to be sure to cover this again. And so we're grateful to have Dr. Erin Kelly with us today. Dr. Kelly is a palliative care fellow at Jefferson, her first Doctors In program with us. So we're very happy to welcome you into the Doctors In program. Before I turn it over to Dr. Kelly, just a couple of housekeeping things that, again, at this point, for those who have been with us on programs before, will be just a review. At any time, you can ask your questions in the chat or in the Q&A feature. Do know that when you put things in the chat, it does attach your name to it. If you have any questions or experiences to share that might be more private, you should ask those using the Q&A. And there is an option with the Q&A to ask your questions anonymously. I will be keeping an eye on both the chat and the Q&A. For anyone on Facebook, you can put questions in as comments to the Facebook video. I'll be checking those as well, and we'll pause periodically throughout the presentation so I can relay the questions to Dr. Kelly. We'll have some time at the end to take questions as well. With that said, I'm going to turn it over to you, Erin, to get us started on the presentation.
Thank you so much, David, and thank you everyone who's joining us today. I'm really excited to give this talk because a lot has changed since it was last given by Dr. Love, as David mentioned, in November 2019. So again, my name is Erin Kelly. I'm one of the palliative care fellows at Jefferson. And a disclaimer that this is a heavy talk. It can be triggering for some people. And there's some stigma sometimes attached to loneliness, but I'm hoping after today, you can feel empowered to have comfort talking about loneliness and seeing how we can go about improving our wellness and lives. And so this is just an outline for today. They're going to talk about how common it is to feel loneliness, how we define it, what are some risk factors to feeling lonely, and what are the health effects of being lonely, and how can we decrease it? And again, special thanks to Dr. Love for some of the use of her slides, including all animal pictures, which will be a good time that I'll stop and look at the chat and David chime in if there's things from the Facebook chat or the Q&A that I cannot see. And then here's one of just showing some great animals together. So loneliness has actually been increasing, and whether that's surprising or not, since the 70s, it was about prevalence of 11 to 17%. But now there's been studies that show even before COVID hit that 60% of American adults felt some degree of loneliness. Other studies have shown different populations around the world, and just in general, adults, especially in the elder community, who have lost a spouse, 1/3, 33% have reported being very lonely versus 5% who have not lost a partner. So there are definitely risk factors that we'll go into. There was a study in New Zealand, but about over 10 years ago, that 33% of people going into the teenage years in the last month of that study were feeling lonely. And then there's been a lot of initiatives done in the UK that I'll get into that have shown certain areas of higher loneliness, and then only some people feel lonely often. So before 2019, just here in the United States, they break it up by generation and income. This was a Time article that was published in 2020. And it shows that just about 50% of people ages 52 and up have been reported to be lonely. And it doesn't change based on income. It actually does go up if you have a lower income, but still at least half the amount of people. And then when we look at if you are living alone or living with someone else, that really doesn't say that you can't be lonely. The living situation does not dictate your feelings. Just living by yourself and living with others, you could actually have loneliness to a similar degree, and males and females alike. Before COVID, with people in our population who are older too, just about 28% of people in the US at the time were living alone. And that meant that they weren't having as many social interactions. And so then when you bring COVID into the mix, that is a significant amount of people who we are discussing. So 28% of older people living by themselves. And so that's about this population, given the amount of people in America are about like 300 million. And then COVID has made the epidemic of loneliness even worse. So they are calling it an epidemic of just loneliness, not even COVID. And that means that more of us are feeling some kind of idea of what it means to be lonely. So anyone, anywhere of any age can experience loneliness is what I'm trying to convey here, so that you're not alone in feeling that way, even though you may feel lonely. And now bringing it back to present time, since the pandemic started, roughly a third of Americans have reported feeling lonelier than usual, which is higher than before. And if you look at this graph, it was just based on they only did male or female. They didn't ask for other sexual orientations, but generation-wise, they did show that it's more common to feel lonely than not to. So you are not in the minority if you are feeling lonely. I thought this was a really great quote that I saw from the late Robin Williams. I used to think that the worst thing in life was to end up alone. It's not. The worst thing in life is to end up alone with people who make you feel alone. And that really encompasses the definition of loneliness. Loneliness is a subjective feeling, meaning that it's based on how you feel, and no one can tell you that your feelings are wrong. It is a discrepancy, meaning that what you prefer to have as your social relations and what you actually have are not in line, and there is a balance that is off. That does not mean that feeling alone means being alone, and that being alone does not mean that you have to feel alone. So it's separating the actuality with what you perceive to be. You can feel lonely in a crowd or in marriage. You can enjoy being alone too. And sometimes we need that space by ourselves in order to reach higher growth potential with our personal goals in life. And sometimes taking a temporary break from the demands of modern life really allows people to have experiences that some will call existential, that bring about more meaning to their life by taking a step back. So it's not always a bad thing. And so I just wanted to touch that subjective social isolation is what causes those feelings. This is so important to define loneliness because by defining it, we know how to treat it. Sometimes there can be misinterpretation that loneliness is depression, and they shouldn't be treated the same. And that's why it's so important to not mistakenly diagnose someone as depression if it truly is loneliness, because they are treated differently. And we have to acknowledge that first by defining it. And this is so important, so I wanted to highlight it again, that social isolation is not the same thing as loneliness. During COVID, we've talked about, social distancing, but what they really meant was physical distancing. It did not mean that you have to distance yourselves from others. And physical distancing was to help your health, but just as important, your health is to have those social interactions that you need. And so social isolation is different. That is an objective finding, meaning like your heart rate, for instance. I can take your heart rate and it says that it's, fast, over 100, but how you feel, you may not feel that it's beating fast. And so I do not treat just the number, I treat how you're feeling. And same thing, loneliness, you can feel lonely, and that's what we're going to treat rather than just you being alone, which is objective social isolation. There are 3 types of loneliness that studies have kind of broken things down into. The first one is social loneliness. And so that can be the absence of kind of a network of people. It can be friends, family, or a community surrounding you. The second type is an emotional loneliness, where you don't have that trust that you rely on or someone else for that support when things are going to be hard. And then the third one is existential. So life-threatening illness or in a trauma where we need more support. And they are not mutually exclusive. So you can have feelings of loneliness in more than one of these categories at the same time. And so when we look at how the depth of loneliness, the emotional loneliness that I just talked about kind of goes along with intimate loneliness. And so that's like a significant other. That significant other, if you can see on this picture, falls in that personal space. And that is usually around, you can only really have like 5 people who are like in your inner core, because after that, it's really hard to get to the depth and be able to have the time and energy too to keep up those relationships. They can be often, rewarding, but time consuming. And so that's the emotional space that we talk about. The social loneliness is also a relational loneliness. And so that falls in the second ring here, kind of like when you talk about rings on a tree. And that is 15 to 50 people. So that can be friends, extended family. That's more of called a sympathy group. And so it's not so much as the quantity, but the quality of relationships that you get from that circle. And then your third circle is a collective space. And so that's an active network. So maybe that is a group, kind of like our group meeting today. Maybe that is a church that you're involved in, or a school or a team, something that's in a public space that you have something in common with, like being an Eagles fan, but you have that collective group, but you can still feel lonely. And it's hard to really say how you feel sometimes. And so you may feel lonely, but it may come out as feeling sad or scared. It may come out as feeling anxious or abandoned or just not being understood by others. And so it's really kind of a silent suffering that people go through, that they feel distanced. And sometimes people deny that they're feeling lonely, and that's more of an attempt to self-preserve because we want to still make it through and say, I don't need that person, when it's really important to kind of acknowledge, well, why do we feel that way? And looking into ourselves more. And how can we anticipate, how our interactions are going to be? That really affects how we react and look at our relationships. This has been shown events earlier in life, such as personality types, how we cope, does affect our risk of loneliness. And so naming what we're feeling is really important in order to be able to find a way out. Because otherwise we might end up in a downward spiral. And this is what we don't want. So first, you might have a circumstance or an event that kind of makes you feel maybe it is anxious and we don't know that it's loneliness yet. And then we get negative thoughts and feelings. These can be internal or external. So maybe it is social media and you're seeing people who are out and about and they didn't invite you and you're thinking, oh, that's them. And that's just external problems. And without talking to them, you might not realize, that they were thinking of you. It just happened that, out of sight, out of mind, they haven't talked to you for a little bit. And is this a stable or a variable thing? Sometimes we feel lonely all the time, or sometimes we have peaks and valleys. And so then our behavior leads us to withdraw from others. And so then we have less activity. Our thoughts then become more negative. We withdraw even further, and that really increases the loneliness. And so that's kind of the definition of loneliness. And so now we're going to look at risk factors and causes. And before I do, this is our first little animal slide. So I just want to make sure there's not any questions or things up until this point.
Nothing coming in yet, but just a reminder for folks to feel free to put things in the chat or in the Q&A. I just wanted to mention, Erin, I appreciate the mention of sort of social distancing versus physical distancing. Because thinking back to last March, like social distancing was such a buzzword, such a commonly used phrase, and it took a while for people to really start pushing back to say, like, this is not the time for us to be socially distancing. This is the time that like social connection is more important than ever, but it's physical distancing and sort of how to have that social connection while staying physically distant. So I just want to say I appreciate the mention of that.
Yeah, our words are so important. So this is a model for the causes of loneliness. And so some of the factors kind of predispose loneliness. They can be characteristics of the person. It can be from a situation or just our culture norms and values of what we hold important. And then we have what our definition of loneliness is. So here's our desired social relations versus what's actually happening. Then we have something that happens that kind of triggers us to have this experience of loneliness. Some of those factors from those three circles could be our tendencies and thoughts, feelings, and behaviors. It's really hard to look internally when we think and only see that what's happening externally and attribute that as the cause. But sometimes maybe our mind has really gone down a rabbit hole and changed kind of what our brain saw versus like what our heart felt. Our situational characteristics are sociological and demographical. And then cultural can be our social roles. What is our status and our identity? And within that is kind of having a purpose of what makes us want to live life and what gives us joy. Personality, as I mentioned earlier, does matter too. We have biases in processing social experiences, just as we have biases in anything. We have a preference for which food we want to eat or where we want to go eat or what we want to do in our free time. And so they really play an impact in how we interact with others. You are at increased risk to be lonely, actually, if you kind of easily get distressed or have a difficult time regulating your emotions, that you can go from 0 to 60 in less than a second. But you have a lower risk, actually, if you're more conscientious, if you're extroverted. And then along with this, there's that matter of, like I said, time. And so if it is just a peaks and valleys, then an optimist can kind of get through it a little easier because they see it as not permanent. Whereas a pessimist or person who's a little more half empty may see it as longer lasting and kind of personalize the reasons and ignore external causes. Anyone is at risk for loneliness, but especially marginalized populations, meaning older adults, marginalized meaning gender, LGBT, race, minorities, African American, they are higher risk, and studies have been shown to show this. Also, living alone If you're not working outside the home, which many people are not given this last 2 years, if you have long-term health conditions, mental health conditions, and especially if you've lost your significant other, add that in with being older, and it's really high risk, and it's not surprising, and it's expected kind of sometimes, but not all the time. And I think that's where a lot of people say, I'm lonely just because I'm older and it's, expected. It's just part of life. And that's not the case. It is normal to feel lonely, but it's not normal to be lonely and not be able to get the interactions that you want. And we can change that. And again, going back to that COVID, quote unquote, social distancing, it is having mental health ramifications. Acute loneliness can transition into a long-term problem with really long-term consequences. And so that's what we're going to get into now. We are meant to be social creatures. Just because we can be alone doesn't mean that we should be alone. We actually, some of the phrases are can't live with them, can't live without them. Some of the people who just drive us crazy, they really do give us the other benefit of making us strive to be our best and reach our higher potential. And so it's weighing that risk benefit. But no man is an island. It takes all types, to go around, and we're meant to be with other people. And so social species like humans require not only the presence of others, but significant others who we can trust, who give us a goal. And the physical presence of significant others is not good enough. We have to feel connected in order to not feel lonely. And so that's where we're heading. I see some Q&As popping up. So I'm going to stop here.
Yeah, so I'll give you the first one, which was going back a couple slides when you're talking about some of the risk factors, but just some clarification around how consciousness would, how that relates to mitigating loneliness. So I'll let you take that one first.
Yeah, I think it's really interesting, and that's what we'll get into treatments too. Mindfulness is a big treatment of many things, including loneliness. And so sometimes our unconscious biases versus our conscious biases play a huge role on how we go about our everyday life. And so consciousness is just being aware to know that this is what I'm feeling and why am I feeling it? And so that's more the consciousness and knowing that it's okay that I don't have anyone around me, but why do I feel that way? And so knowing that I do enjoy these types of interactions. And that's the consciousness part of it, to really take a reflection on what do you enjoy? And it takes some self-reflection, and it's a lot of work to figure it out. Hopefully that answers it. I will have more later. And so if that doesn't answer the question, we can revisit at the end.
Great. Thanks, Erin. And the other one, and you might be getting to this later on too, because I know you were going to talk about some of the things that we can do in response to loneliness. But I'll read the question. How does one find their way out of the severity of the loneliness when it feels like a great effort just to get dressed, showered, etc.? Feels like I have to relearn everything socially.
And sometimes we do, because we need that purpose. We need to know what motivates us to get dressed, to get showered. Even if that is a lot of effort, if we know that it is worth that effort just to go see the one person for lunch, then that's what we really have to weigh out. I can definitely sympathize with feeling that effort, and it is not easy by any means. None of this work is going to be easy, but it is definitely doable if we want to. And thank you for those great questions. So now we're going to move on to how does this correlate with our physical health. Loneliness has poor physical and mental health outcomes. It has been studied. It has been studied more now in the last 2 years than ever. It can cause us to have high blood pressure. It can lead to heart disease. It can cause us to have suicidal thoughts. It can lead to unhealthy habits such as overeating and less physical activity to cause obesity. It can be impulsive, weaken our immune system, secondary to stress. Yes, stress is real. Decreased sleep, depression, as I mentioned earlier, inflammation, which is due to that weakened immune system. It can worsen dementia. It can cause us death. It can really be detrimental, and other things such as alcoholism and substance abuse. And so I do feel like this is important just to say, chicken or the egg. Is depression a symptom or a cause of a health issue? Does someone withdraw because they're depressed, or do they become depressed because they're lonely? And so I really think it's important to kind of take a step back. Yes, they are related, but they are not the same thing. And so on the flip side now, what are the benefits of a strong social network? It does make us healthier. It causes us to release less of a stress hormone, cortisol, which then does lead to a decreased risk of, this is cardiovascular disease. I'm sorry, I didn't spell it out, but heart disease. It does increase our survival by as much as 50%, which is huge. And without a social support, we have less chances of like a recovery after serious illness, like a stroke, for instance. And they attribute the effects of loneliness as smoking 15 cigarettes a day, which is a lot of stress. And other reasons why social interaction is good is just feeling supported can make a huge difference of our mental health, regardless of how much you're actually doing. So again, reality does not equal how we're feeling. So just because you may see one person a day and someone else might see 50, or you may have one great friend and someone else has 5, it is the quality, not the quantity. And it's going back to feeling supported. It really is just as important as getting enough sleep, exercising, diet, and our brain seems to work better when we're actually with other people, bouncing ideas off of each other, stimulating. There is, safety in numbers, and gives us that opportunity for growth. And so we're transitioning now into how do we fix it? And I see there's something in the chat, so I'm just going to take the time.
Yeah, and this was just, I think, in response to the last question about how to sort of get out of the feelings of loneliness and not being able to feel like you can get out of bed in the morning and get dressed and showered. Was just a comment, and thank you, Keith, for knowing when to be proactive and calling out to your support networks. And I think, as you're saying, Erin, sort of that support network may look different for everyone. For someone that might be one close friend, for some people that might be a broader network of neighbors and community members. But so I think the comment, Keith, is just sort of reaching out to those networks, whatever your network looks like.
Absolutely. And so how do we fix it? First is identifying it, because a diagnosis, in medicine is how we know what the treatment is. And so by knowing that, okay, we're dealing with loneliness, that's the first step. And then how do we address the reasons as to why we feel lonely, and what other interventions can we have? So now we're going to work backwards up a spiral to get out of loneliness. And this was this is done actually in the UK. It was a campaign to end loneliness, and they have great resources and information. And so that's where this information is from. First is just being aware, that conscious awareness of our thoughts and our feeling related to feeling lonely. And then once we're aware, that is the only way we can change our behavior. So recognizing that I'm thinking negatively, being present in the moment of that's a negative thought. And yes, it takes a lot of work to just say, I have to change that. And that's then when you can change your pattern, which is really hard to shift, and you have to want to do it. And sometimes you're not ready for it, and that's okay. Knowing that these can be changed, challenging that those automatic. So the difference between a reaction and a response. We are reacting possibly negatively when, if we take a deep breath, wait those 3 seconds, and we respond, it may be less triggering and therefore less stressful, less chance to get our heart up, our blood pressure up, and have the better health effects also. And then we shift into that positive change and be the change that we're looking for, and engage with other people and increase our activity and our engagement. And so that's the goal. How can we do that? One study that has been done is cognitive behavioral therapy. It's been around a long time. This is a type of therapy that is used and shown to work not only for when you go to a counselor for grief or depression, but also for loneliness. It is just understanding your thoughts, feelings, and behaviors, because only when we understand is how we can change. It's unhelpful to be catastrophizing, where the whole world's out to get me. This is all terrible. Black and white thinking. There's a lot of gray in between, and we shouldn't be reading minds. You know, we make assumptions. I do it too. I'm guilty, but it's actually easier to just state your feelings. And so if someone, didn't include you, you can just say, I was hurt that I didn't know that you were going out to lunch, perhaps, rather than just in our heads coming up with a story, because it does it unconsciously. Oh, they didn't call me because they didn't like what I said 3 weeks ago. It does happen. And we can only change that when we take that step back to respond. The second one is mindfulness, and I have a couple slides on that next. And I did do a course on mindfulness. Mindfulness is a practice called awareness that is just paying attention on purpose in the present moment, non-judgmentally. They should have highlighted it, circled it, starred it. That's the big thing that they will always say, mindfulness, non-judgmentally, to not judge yourself for your feelings. And then you can choose to accept or reject that feeling. And the third one is positive psychology. And I have a slide on that also. It is promoting positive emotions and helping to override that negative thought and thought pattern.
I could just jump in real quick on here also, Erin. One of the things with the CBT, cognitive behavioral therapy, and I'm putting on my social work hat. It's been a couple of years since I've had my clinical training. But I think one of the things with that too is helping people to take that step. So if there is a barrier to reaching out to your support networks or to initiating contact with a friend to join a Zoom or to have a meal together, that CBT can also sort of help someone to work through those steps of how to make those easier, how to find sort of the connections between those actions and the thought processes behind them. So I just want to put that out as, again, thinking back to sort of the question before about feeling like you can't get out of bed in the morning or get showered or get dressed or get going, that's another place that I think CBT could be a useful therapeutic intervention.
Yeah, and CBT is offered by licensed clinical social workers, by therapists, sometimes psychiatrists do it also, but people who insurance can pay for it. Usually you just have to find the right provider. Yes, it can be expensive, but it's just calling insurance. It takes some work, but you can get it covered by insurance to talk through it. And it's not to say, you're right or you're wrong. It's just a safe space to talk through things non-judgmentally also. And so that's, again, non-judgmentally kind of goes in all of these. Dr. Love, Jill had this link and I followed it for us so that this is kind of what's out there. There's been a lot of talk about Headspace and Calm over the last 2 years because they had commercials. And so, of course, I downloaded those, and Waking Up too. And some of these other ones I haven't heard, but it's really about finding what's best for you. Like I said, we all have a preference. Sometimes someone's voice isn't appealing, and so you don't want to listen to that person leading your meditation apps. But other times you've found someone that you relate to, and it's just keep trying, And so these were some of the overall apps, if you wanted to take a peek at any of those. Some of them have free downloads, and some of them do cost. Another one that's not listed here, but I have heard of is 10% happier, if anyone has heard of that one. And if anyone has ones that they've used or that they've liked, feel free to throw them in the chat, and we'll get conversation going. So this is actually happening tomorrow for free at Jefferson. So this is our institute, the Mindful-Based Stress Reduction, that they have sessions ongoing throughout the year. And it's free introductory version to see what mindfulness is all about. They used to do it in person, but ever since COVID, it's been through Zoom. And I have the information on the next slide, but this is a course that I did take. And I will tell you, it was hard for me to get into it, because when life's good, it's good, and you don't feel like you need this. And when life's tough, you don't feel like you have time for it. You really have to be ready to make the change to incorporate this into your daily practice. It's a practice. It's not meant to be perfect. It's meant to try along the way. Alize leads it, and she's wonderful. This is through the Marcus Institute of Integrative Health. And so if you want to register, you can email them to get the information for tomorrow from 6 to 7 on Zoom. And you just need a working computer, which I assume you all have because you're on here. That is the intro course. I will say that that is great, but it does get expensive. So if you took the real course through Jefferson, it is almost $500. They do give some discounts. They do have some financial assistance that can be considered. It's worth asking. I'm not saying that this is, the end all be all. It works for some people and it doesn't for others. But if you want to try it, I just wanted to throw it out there that I saw it and wanted to share with you. The 2 courses that they have coming up, they have Wednesdays from 9:30 in the morning till 12. They meet every Wednesday for about 2 months. And then they have a retreat day that it's just a full day of all practices. They do mindful eating. They did a practice on mindful movement. So a yoga, mindful meditation, where you kind of start your day. So it gives you a lot of tools to see what works for you. So that's the good part about this course. And then they have one Thursday evenings if that's better in your schedule. And positive psychology was the third one that I mentioned. So you had CBT, mindfulness, and then positive psychology. And so it's really a framework to promote well-being. And this is the acronym they use: positive emotions, engaging in satisfying tasks, what gives you joy, relationships positively with other people. Not all relationships are not good, and you don't need to stay in a relationship that's not positive and rewarding and supporting you emotionally. But it's to find those ones that are a two-way street, giving you purpose in life and setting those meaningful goals in life. And when we look at interventions, whether it's CBT or mindfulness, first they have population-wide. And so that is, maybe there's a group that reaches out. Then there's a group that's a smaller community, and then there's one-to-one. And so the intensity depends on the severity as to what's going to benefit you most. Those one-on-one group or communities are to give and get mutual support. Again, it's really important to have it as a relationship, meaning it's for two people, not just give, and someone takes. It is to have meaningful relationships and to master our skills and to find what is not working for us and to change that awareness, to get rid of irrational beliefs. And this has the largest effects, the CBT. And so I did want to point that out. And again, a lot of people do find help if they are spiritual in spiritual organizations. And even if they're not, there are groups, agnostic, that people have found helpful. There is a force that it's clear religious activity is a positive force for those who are already inclined to do it. So that's just why I want to mention it. And in case you're just needing more reassurance, managing in a group, you want it to be accessible and inviting. So this is what you're looking for if you find, okay, I want to find a group. If people are going to be trustworthy, to keep your confidentiality, and that the effort to attend isn't too much, but it gives that dedicated time and space and allows you to kind of work on that art of conversation that they have a warm greeter to encourage you and welcome you and provide what you're looking for, whether that's humor or just caring in a non-judgmental, encouraging way. And then you're heard, and maybe you break into smaller groups too. And if you're trying to manage alone, that's okay too. It's reflecting on what triggers us and writing things down and going back and assessing. Sometimes it's going outdoor to connect with the environment in nature, maybe doing activities from gardening to get a sense of purpose. I am in palliative care, and some of what we do is hospice, which is patients who are at the end of life, and death is a part of life. And I have found a lot of colleagues of mine garden because they see that as living in life and green. And so that gives them the sense of what is lost is found. And so I find that really deep and engaging. And I wanted to throw gardening in there. And plan short term, because long-term goals, while they're great and we need them, sometimes they're overwhelming. And so short-term goals can be more manageable. It can be more manageable to say, today I'm just going to call one person who I haven't talked to in a while. And yes, you went through the effort of getting yourself together and making sure that you had the time to sit on the couch if that person does like to talk for 5 hours, but you get something out of it and you do find joy at the end. Short-term plan, a couple weeks ahead. And then talking about it, whether that's talking with yourself, talking with someone else, talking to a higher power, if that's within your belief, or writing it down. And I put this animal slide in just to break up. I have more about a treatment here, but I just wanted to take a visit to the chat and questions.
Yeah, so we got a comment in the chat when you were talking about mindfulness, just that there are lots of great mindfulness resources on YouTube that can be accessed for free. So thank you, Lauren, for that suggestion. I put in the link to the campaign to end loneliness. You've mentioned how a lot of this is coming out of the UK. And I have found that too, that the UK was just so far ahead of the United States in sort of researching loneliness as a public health issue. And yes, the campaign to end loneliness is based there, and they have a lot of great resources. I think they have there's like a federally appointed loneliness czar in the UK. And so hopefully we're catching up there as well. And then Keith put in the chat just the advice of telling people to start with baby steps, going along with what you were saying on sort of the best practices.
Absolutely. Yeah, thank you everyone for engaging and interacting so far. This is great. And out of the UK, they had this 5 ways to well-being, in case you find this more helpful with colors and non-acronyms. First, it's connecting, whether that's with nature, with people, with a neighbor, in the community, thinking of those kind of as the cornerstones. And a cornerstone being, I have this little triangle pyramid here, but this is our mind, our body, and our soul, and we have to take care of all 3 to get to ourselves. And so kind of finding those connections that make us being able to be on the top of that pyramid and investing in them. It is an investment. Being active, getting outside, some physical movement, it's been shown it's helpful. And taking notice, to be curious, to be in the moment, be present, and taking in of what's around you so that you can feel alive. And keep learning, do something new. Of course it's scary, but it's what gives us sometimes the rejuvenation that we need, and giving us a task to make us, continuing to grow. And then give. Some people find giving and doing something, acts of kindness for someone else, gives them meaning and joy.
I think along with giving, also just knowing that volunteering is a great way to meet other people who share similar interests. And certainly we've talked about that before as sort of another resource that folks have.
Absolutely. And then these are just some other approaches that have been studied. And I wanted to tell you about them, but so that you know that the research isn't robust, but that doesn't mean that they don't work. It's just we don't have the research. So the first one is called acceptance and commitment therapy. That is a therapy that was designed to stop avoiding, denying, and struggling with like inner emotions, and instead accept it and work to let it out. And it uses all the senses in this next one, reminiscence therapy. So sight, touch, taste, smell, and sound. It's usually in people with dementia to help. And the third one is humor, the power of like laughter and aiding in healing. And so laughter actually decreases stress hormones, increases immune cells to fight, and improves our resistance and resilience. And it triggers endorphin release, the feel-good chemicals. And so don't discount laughter. And so you can, of course, find something on Netflix that makes you laugh. Or if you don't have Netflix, YouTube, as Laura mentioned in the chat, just for mindfulness, also comedy. And I wanted to let you know that going back to social species, a lot of this is based on animal study too. We're not alone. And so a lot of people have found the research from animals. Prairie voles and these like titty monkeys are the social animals that have been studied the most. And isolation has had terrible effects on their cognitive ability and their emotional ability. But there is some evidence that sometimes medications can help. And some of the medications are the same as when we're treated for depression, such as it's called a serotonin selective reuptake inhibitor, fluoxetine or Prozac, but it works differently than it does in depression. It doesn't work at the serotonin level, blocking the reuptake. They're still working on how it works, but that is being studied. There's another study that shows that a stress hormone is lower. And then oxytocin, as we always hear, like with moms and babies, that it can be increased and work with a medication to express that more. But with everything, there's risks and benefits. And so this is a brain-derived neurotrophic factor, that's a fancy name, BDNF. But when we're trying to increase our oxytocin with a medication, you can also heighten all emotions like aggression. And so they aren't without risks. And so medication I save to the end because it's not the end all, and it's not the easy fix. Sometimes there is room for it, but it's really just been studied in animals. And so other ways that we have seen in the last year is definitely technology increasing our social network. So I think most of us were used to in person. We would visit people in our free time. We would see people at work. Meals were a very big way to kind of hang out with others and talk. And with COVID, and especially restaurants shutting down if you live in the city, and restrictions, it made it hard to feel comfortable even going out and having a meal with someone else or doing an activity. And so sometimes people have found that they can do that over Zoom. People were still doing Zoom holidays with their families if that's what was important to them. So still being together, though not physically together. But we can increase technology with phone calls, texting, email, social media, and it can be overwhelming. So knowing what works for you. This is something I found that is a Philadelphia area social group, and it pairs up with a member for a weekly video chat and communication exercise. It's called Let's Be Authentic, and it's a team support. I did not see if it cost anything. The impression I got was that it did not, but it's 2 hours a week. The other one that they had, it had started back in October, so I don't have the most up-to-date information, but I did want to let you know that this was out there. Just as an example, there's many organizations too that are nonprofits that do have someone who will reach out to you to kind of check in and see how you're doing too. And so I encourage you to find those resources that would be beneficial. Things to consider though when doing virtual interactions is that it's not a perfect solution. Not everyone benefits equally from digital interactions. Some people have found that it is too hard to be on all the time, always having your video on, you feel the pressure to maybe get dressed up, look your best, and you may not feel present with people because it's virtually. And virtual shouldn't replace valuable in-person moments, going forward, if that's what is most helpful to you. But being on social media, sometimes people, like I said, feel left out, and maybe cutting that social media time back, and rather than looking at other people of what they're doing, worry about what you want to be doing. And the last thing is pets to the rescue. There's been some studies out there just by having a pet that people have found it reduces loneliness. And so having a companion animal has been shown to be beneficial. Subjectively, most people are just saying this, oh, it's been great for me, but I think it's worthwhile. And so in summary, I wanted everyone to know that anyone, anywhere, any age can experience loneliness, that it is this discrepancy between what we want versus what's actually happening with our social relations, that it can lead to poor physical and mental health outcomes, but it can be managed if we are open to it. And I wanted to take this time for the last few minutes to answer any questions or field comments for discussion.
Great, thank you so much, Erin. And again, folks can get their questions in. I'd also encourage folks in the chat, if there are, and I recognize many names, some of you are professionals as well as community members, but if folks have either programs that you utilize or programs that your organizations run that help to foster some of the social connections and social support, please do feel free to put those in the chat. I'm going to send some links here also. One question I would love to ask you, Erin, and that we always try to cover in A Doctor Is In, is what should people bring up with their doctor? I know oftentimes when we see our doctor, we're thinking about, what physical ailments we have, questions about our physical well-being, but don't necessarily think as much about, how to bring up something like loneliness or mental health. So I'm just curious what your advice would be to someone about how to raise these issues with whether it's a primary care doctor or a geriatrician, whoever they're seeing.
I think that's a great point, because when we sometimes go to a doctor, we have to have a reason to go. And when it comes to feelings, it's a little hard sometimes to know where to go. And I think just going in and saying, I want to make an appointment to talk to my doctor about my, feeling lonely. You can just say that, or feeling down. And so that this way they can screen you to make sure that we don't think that this is depression that's leading in. But a lot of the times it's so important to know, what do you want covered when you go to the doctor? Because it's very easy for the doctor to say, you're here for this and this is what I'm covering. But if you labeled it wrong, it may be missed. And so I think when you go and say, Doc, I'm worried about that I'm lonely. I've lost weight, perhaps. And so wait a minute, that might be depression. Let's screen that first, because we don't want to miss that. And so I think just finding a provider that you feel comfortable with to talk about. And if you don't, then finding someone within that office who can help advocate for you. There's usually the medical assistant who you're easier to talk with than maybe the physician. And so I think knowing whoever's going to get that information across the best. And maybe it is bringing someone with you, or saying, can you call this person? I've talked to them about it. I'm just having a really hard time saying it now while I'm in the office. Can we get my loved one on the phone? Or I've written things down. It's hard for me to talk about. Can you just read what I've written down? Sometimes that's easier for people to do, have someone read something than to actually talk about it. Because unfortunately, we don't know unless it's asked or unless we tell someone. And so that's usually the hardest part. And I'm glad you brought that up. And then being honest, I guess, what you're willing to do, because at the end, it's really, the doctor can say, oh, well, go to therapy. You have to say, I don't know if that's going to work for me. What do you think, doc? Like, what have you seen work for people? Do you have experience? And if you can't relate to the doc, that might make it hard, or if they can't relate, but they may have some other ideas. And so I think sometimes asking the doc, like, well, this is what I've tried, or this is what I want to try. Do you know any resources or who I can reach out to? And sometimes they do have a social worker that's available, or another resource that we didn't know about.
Great, thank you.
Yeah.
A couple things in the chat. We did get a comment that the Mazzoni Center has also done some good work on mindfulness, so that they could be a resource for folks interested in learning more about mindfulness and how that can improve health. I put in a couple of links, one for the William Way Peer Counseling, which is a free service for folks wanting to talk to someone in the LGBTQ community about any really of any topics that might be of concern. Also, the Sage Connect program, run nationally by Sage, is similar to what Aaron was talking about with many of these programs, where there could be a monthly, or I think actually Sage Connect is weekly, a weekly phone call from a volunteer, either by phone or by video chat, to offer some of that connection. I also put in the link for the trans programming at William Way. The Trans Way group meets weekly for trans and non-binary individuals, offering some of that social support and connection. And then I just got a comment here from Alice that there's a lesbian mindfulness group for no fee, and that she would be willing to provide some connections there for anyone who's interested. And I'm happy if anyone wants to email me about that. I can make that connection to Alice, if that's okay with you, Alice.
Yeah, it looks like one person is interested, so that sounds good.
Awesome. Mary, I'd be happy to connect you and Alice.
And this is a great way to anonymously to send to David today, or to message him if you need any link ups.
One of the things we can also help with, I didn't mention our Thrivers program, which is a monthly group for people living with HIV. We just did something last month talking about technology and the digital divide, and our group came up with lots of great resources. So if there are folks who don't have the technology to do some of these video chats or joining different online groups, we do have a lot of resources, and so I'll put my my phone number there as well. So if you or others in your network are feeling lonely for one of the reasons being that you don't have access to video chat technology, let us know and we can try to help to connect you to some local resources there. I think that comment from Jeanette was part of this, being part of the Sage Connect program. So we are right at 1 o'clock. Used up all of our time today, but really appreciate the questions, the discussion, and of course you, Aaron, for sharing all of these wonderful resources. I think it's just so telling, the statistics of, and it could be a very heavy societal question of, what we're doing, that the majority of people feel lonely. So just knowing that you are not alone if you are experiencing that, especially after the past almost 2 years at this point. So I'm going to leave it. Actually, I'll leave it to you, Aaron, for any closing words.
No, I really appreciate you guys having me. And I think this was an important topic, and I'm glad you brought it back. I don't know how often we cycle back to other topics that were discussed in the past, but I think this was really timely because a lot has changed and a lot is being done in the last 2 years for loneliness, and to keep looking for avenues that will work for you.